Want to score over 850 in your Med Surg Hesi? Then let's get started. A client is admitted with acute exacerbation of COPD. The nurse assesses the client's arterial blood gas results, noting a pH of 7.32, pCO2 of 60, and 8CO3 of 29. How would the nurse interpret these ABG results? Respiratory acidosis with metabolic alkalosis, respiratory alkalosis with metabolic acidosis, respiratory acidosis with metabolic acidosis, respiratory acidosis with metabolic compensation. The correct answer is A. A low pH and elevated pCO2 indicate respiratory acidosis. The elevated HCO3 suggests metabolic compensation in the alkalotic direction, leading to the interpretation of respiratory acidosis with metabolic alkalosis. A client with pneumonia is prescribed chest physiotherapy. What is the primary goal of this intervention? Improving oxygenation, reducing pleuritic pain, enhancing bronchodilation, facilitating airway clearance. The correct answer is D. Chest physiotherapy is aimed at mobilizing and facilitating the removal of respiratory secretions, thus promoting airway clearance. A client with asthma is prescribed a SABA inhaler. The nurse educates the client that this medication primarily works by reducing airway inflammation, relieving bronchospasm, suppressing cough reflex, preventing histamine release. The correct answer is B. SABAs, such as albuterol, primarily work by relaxing bronchial smooth muscles, relieving bronchospasm in conditions like asthma. A client with acute respiratory distress syndrome is receiving positive and expiratory pressure during mechanical ventilation. What is the purpose of PEEP? Enhancing oxygenation, reducing airway resistance, preventing barotrauma, promoting spontaneous breathing. The correct answer is A. Positive and expiratory pressure helps to maintain positive pressure in the lungs at the end of expiration, preventing alveolar collapse and improving oxygenation. A client with chronic bronchitis is prescribed theophylline. The nurse monitors for the therapeutic effect of theophylline, which is primarily diuresis, bronchodilation, anticoagulation, hypoglycemia. The correct answer is B. Theophylline is a bronchodilator used to relax the smooth muscles of the bronchi and bronchioles, resulting in improved airflow in conditions like chronic bronchitis. A client with pneumonia is experiencing chest pain and shallow breathing due to pleurisy. What position should the nurse encourage to alleviate pleuritic pain? Supine, Fowler's, side lying, prone. The correct answer is C. Positioning the client in a side lying position may reduce pleuritic pain by minimizing the pressure on the affected pleura. A client is diagnosed with obstructive sleep apnea. The nurse identifies a risk factor for OSA in a client who has BMI of 18.5, large neck circumference, hypertension controlled with medication, regular exercise routine. The correct answer is B. A large neck circumference is a risk factor for obstructive sleep apnea, as it may contribute to airway obstruction during sleep. A client with emphysema is prescribed long term oxygen therapy. The nurse educates the client that L-TOT is primarily aimed at reducing bronchospasm, improving lung compliance, preventing respiratory infections, correcting hypoxemia. The correct answer is D. L-TOT is prescribed to correct hypoxemia and improve oxygen saturation in conditions like emphysema. A client with a pneumothorax undergoes chest tube insertion. The nurse monitors for complications, recognizing that the purpose of the chest tube is to facilitate air removal from the pleural space, promote lung expansion and reinflate the lung, drain excessive pleural fluid, monitor interpleural pressure. The correct answer is B. The primary purpose of a chest tube in a pneumothorax is to remove air from the pleural space, allowing the lung to re expand and promoting lung expansion. A client is admitted with pulmonary embolism. The nurse monitors for a potential complication of pulmonary embolism, which is bradypnea, hypotension, increased oxygen saturation, decreased heart rate. The correct answer is B. Hypotension is a potential complication of pulmonary embolism, as it can lead to decreased cardiac output and compromised perfusion. Click that subscribe button and let us know how many you got correct. Join us